So pronator quadratus, flexor ditorum profundus, and flexor pollicis longus, these are the deep muscles of the flexor compartment of forearm. Here, you can also appreciate that intraosseous membrane is present, and anti-intraosseous artery and nerve is running over here. Almost all over here, we can see this big nerve, that is median nerve, that is running. If you see here, from cubital fossa, piercing the pronator teres, it is coming down, supplying all these flexor compartment muscles, exer flexor, carpi ulnaris, and the medial upper flexor ditorum profundum, which is supplied by ulnar nerve. Since these all muscles are flexor and help in making a fist, which is useful for a laborer. That's why median nerve is named as laborer's nerve. So that is about the flexor compartment. Now we turn and read to the extensor compartment. Extensor compartment is a little bit odd because we do not see here anconius in the superficial.